idea later on. And now moving from the bony part of the thoracic cage to the muscular part, the muscles that seal off the spaces between the ribs are what we call the intercostal muscles. Intercostal muscles, they don't actually do a major role during respiration because we are actually breathing by the diaphragm. By a contraction of diaphragm, we are creating a negative pressure inside the thoracic cage, and that draws air inside the lungs, and we are expiration by the elastic recoil of the lungs. But during forced respiration, these muscles do some job. We have external intercostals, and these muscles are arranged in a way that as if you're putting your hand in your pocket. So the fibers of the external intercostal are as if you're putting your hand in your pocket. They are directed downward, forward, and medially. Okay, so these are the external intercostal muscles. They come from the lower border of the rib above to the upper border of the rib below, and they end at the costochondral junction because they would continue as anterior intercostal membrane. Okay, because we need to have a tendon that attaches the muscle to the bone, and this is a thoracic cage. It needs to be a flat tendon, so it's going to be a membrane. However, for the internal intercostal, they start from the back side, they don't start from the front, and they end posteriorly as posterior intercostal membrane. Okay, now what would be the function of the intercostal muscles? And of course, we have the innermost, they lie at the deepest plane, and based on the orientation of the fibers, we will come to know the function. So if we are trying to imagine that, let's go to the next picture and come back. If you guys look at the external intercostal muscles, they as if you're putting your hands in your pocket. They are arranged forward, downward, and medially. So how would be the function? It's from the insertion to the origin. So how would that work for the external intercostal? It's as if you are bringing your lower rib up during inspiration. Think about the orientation of this as if you are holding the ribs that are down and bringing them up. So if the muscle fibers are running this way, it means that when you contract, you are going to move in the opposite direction. You're going to move in the opposite direction. It means elevation of the ribs. So if these are your muscles of external intercostals, it means if they are directed this way, it means contraction brings the rib up. It means they work during inspiration. However, if you look at these muscles going in the opposite direction, all right, laterally, downward and laterally, it means that they are going, when they contract, they will bring the lower rib the opposite direction. And that would happen during expiration. Okay, now let's look at the previous picture again. The external intercostals, okay, external intercostal during forced inspiration. I want to breathe. I want to breathe. Try to imagine it on yourself. I want to breathe. So I want to bring my rib cage up. Okay, so external intercostal is the one to do that job. What helps the external intercostal is the interchondral part of the internal intercostal. If you guys look at this is actually internal intercostal, but this is the interchondral part. What does that mean? It means the part that is between the costal cartilages. Chondral means cartilage. This is part of the internal, but it works exactly the same way the external intercostal does. It works by elevating the reps during forced inspiration. How will you remember that? External comes first. We have to breathe in first. So elevation, if we breathe, the rib cage, it gets elevated and the reps comes elevated. Who is doing that? The external intercostal muscle. Who is going to help in that? The interchondral part of internal intercostal muscle. So these muscles during forced inspiration, they elevate the reps. However, the interosseous part of the internal intercostal muscle, it works like the innermost. The interosseous, what does that mean? It means between the bones. Osseous in Latin means bones. The muscle that is between the ribs, the bones of the ribs themselves, we call them the interosseous parts. What do? They depress. So the depression during forced expiration is done by the interosseous part of internal intercostal with the deepest muscle, which is the innermost. Okay, so I need to breathe in first. Take a deep breath. Imagine yourself breathing, bringing your rib cage up. Elevation. The first muscle we learned is the external intercostal. What the helper is the intercondylar part of the internal intercostal. So these muscles are going to do a job in elevation of the ribs during forced inspiration. And the opposite is true regarding the other part of the internal intercostal, which is the interosseous with the innermost. It's basically depression of the ribs during forced expiration. All right. Now, if you look at this picture again, you guys can see, if you look from inside, the innermost is what lies in the deepest plane. Actually, innermost is not like the external and internal. It's not extending from the start of the ribs till the end. It's actually in the mid portion. So if this is my rib, all right, if this is my rib, then the innermost is only at the mid portion. And this is important because the neuromuscular bundle needs to run deep to this. It needs to come in here and run deep to this, and it will become very well protected between the innermost and the internal intercostal muscle here. Okay, so the neuromuscular bundle, as it comes out from here, it needs to get into deep to the innermost. This is the innermost, and between the innermost and the internal intercostal. These are the neuromuscular bundle, and they are arranged superior to inferior as van. You have the vein, and then you have the artery, and then you have the nerve. So vein, artery, and then nerve. Okay, so these are running between the innermost and the internal intercostal, which are the muscles that are running in the different direction, which is basically this one. This is not dissected one, so this is internal intercostal. These are on internal intercostal. How did I know? Because I cannot see the neuromuscular bundle, and because they are sealing off the whole space of the rib. It means this is the internal intercostal. If I can still see a space, I can still see ribs. It means this is the innermost because it occupies only the mid portion of the spaces between the ribs. All right. And we have two more muscles, the transversus thoracis. From the name implies, it implies that it's a transverse muscle that runs in the thoracic wall. So they are only from the level of rib number 2 to 6. They run transversely, and they are continuous with the transversus abdominis. They are the weak depressors of the ribs. All right, and then we have subcostalis, which is basically a muscle. Can you guys see this muscle that runs from the angle of the rib to the angle of the lower ribs, number 2 or 3? It's at the back side. This is a very deep muscle, well developed in the downmost ribs. All right, and it actually helps in elevation of the ribs. Okay, so these are weak muscles, but we need to know about them when we talk about the thoracic cage. Now, what about the arterial supply of the thoracic wall? Now, the arterial supply, when we talk about arterial supply anteriorly, it's different than posteriorly. Anteriorly, we have the subclavian artery. The subclavian artery gives you internal thoracic, and it gives you internal thoracic. So you have the first 6 intercostal arteries. They are branches of the internal thoracic. The internal thoracic actually runs 1 centimeter lateral to the sternum. So if I look at the anterior thoracic wall from the back side, I can see that the internal thoracic is running lateral to the sternum, both sides. And that gives pairs of intercostal arteries anteriorly. Now, why is it 1 to 6? Because you guys, at the level of the 6th rib, your internal thoracic is going to terminate. And as it terminates, it gives you musculophrenic and superior epigastric. So it means one that will go to the epigastric region, which I don't care about. And what concerns me is the musculophrenic. So at that point, at rib number 6, I don't have internal thoracic. I have a terminal branch of it, which is called musculophrenic, and that will give me the anterior intercostal arteries 7 to 9. طب why is it until 9? Because remember, guys, you don't have anteriorly more than 9 intercostal spaces. Anteriorly, what is connected to your sternum is only rib number 1 to 10. And between 1 to 10 is only 9 intercostal spaces. And these arteries, they supply the intercostal spaces. Below that, we have floating ribs. I don't have intercostal spaces. So anteriorly, I only have the first six pairs of intercostal arteries, and then 7, 8, and 9 from the musculophrenic. These are the anterior intercostal arteries. Lower than that, I don't have intercostal arteries because I don't have intercostal spaces. However, posteriorly, we have 12 ribs. So I have 11 intercostal arteries and one subcostal. And why do we call it subcostal? Because the last intercost because the last space below the rib number 12, I don't have a space. I have subcostal space. I have something down to the last rib. So I cannot call it intercostal because there is no rib down to it. So all of these spaces between number 1 and 12, the 11 intercostal spaces, we have 11 intercostal arteries. Below the last rib, I have subcostal. This is number 12. We don't call it intercostal. Okay, so how do they get their blood supply? They are all taking blood supply from the descending thoracic aorta because this is the big boss that runs in the thoracic wall. So of course it's gonna give everything. But think about the first two. The descending thoracic aorta starts slightly down and it will just leave the first and second intercostal spaces without blood supply because it starts down. So who will take care of that? Thanks to the superior intercostal artery, which is a branch of the costocervical trunk of subclavian. Again, subclavian is giving me literally most of the things in the thoracic cage. So intercostal artery posteriorly 1 and 2 are branches of the superior intercostal artery. It's not a branch of the descending thoracic aorta. And this is a nice summary showing you guys that the first 6 intercostal arteries coming from the internal thoracic, 7 to 9 from the musculophrenic, which is the terminal branch of internal thoracic, because at that point we don't have internal thoracic. They will end as musculophrenic and superior epigastric that goes to the abdomen. And then posteriorly, it is by the first two by the superior intercostal branch of the superior of the subclavian, the costocervical trunk, and then the rest of them are coming from the posterior intercostal. The posterior intercostal are coming from the descending thoracic aorta. Moving on to the venous drainage, the venous drainage has a different story. When we talk about the venous drainage of the intercostal veins, you need to know what happens on the right is not like what happens on the left. First of all, the first posterior intercostal vein, they drain into, first of all, let's say that anteriorly, everything follows the arteries. So if we talk about veins, we are following what happens here. The anterior intercostal veins are following the arteries. However, when we talk about the veins posteriorly, we have a separate story with the azygous system. On the right side, you guys know that we have the azygous vein. On the left side, we have the accessory hemiazygous and hemiazygous. But that happens in the core of the posterior intercostal veins. In the first one, the first intercostal vein drains directly into the right brachiocephalic vein. And the left side, it drains into the brachiocephalic vein. All right, now let's see what happens to 2 to 4. 2 to 4 intercostal veins, they drain into the azygous. Everything drains into the azygous vein on the right side. All of these drain into the azygous vein, and eventually by the arch of azygous, they drain into the superior vena cava. All right, but for 2 to 4, they have a common trunk, and the rest of them, they drain directly into the azygous. So everything on the right side drains into the azygous vein. However, on the left side, we need some connection that takes us to the azygous, and this is also by azygous system. Here we have a common trunk, yes, between 2 to 4, but the common trunk between 2 to 4 posterior intercostal on the left side, they drain into the brachiocephalic vein. All right, because the azygous system is not that much high. Now, what happens to the next 4 and next 4? The next 4 is the accessory. So 5, 2, from number 5 to number 8, they drain into the accessory because A comes first. So accessory hemiazygous comes first. And then the next four, the last intercostal veins, 9 to 12, they drain into the hemiesophagus, and eventually they will cross to the other side to drain into the esophagus system, the esophagus vein, eventually. Okay, so we have the first veins, they drain into the brachiocephalix, right side all into esophagus, left side accessory and accessory hemiesophagus and hemiesophagus, and then they would cross to drain into the esophagus on the right side. All right, and this is just a small clinical applied, is that whenever there is a nerve block to the intercostal nerve, the physician needs to make sure to block more than one nerve because we have a lot of collaterals in between the ribs. And the intercostal nerves are coming from the anterior rami of the spinal nerve. The last concept here is the lymphatic drainage. Again, you guys, if you're not sure about the lymphatic drainage, go ahead and watch the basics in lymphatic drainage video, the overview of lymphatic system. That will help you understand the lymphatic drainage of the thoracic wall. But when it comes to the thoracic wall, you need to know that anteriorly, the right anterior intercostal nodes, we need to, whenever we want to drain lymph, we need to drain into lymph nodes, and from these lymph nodes into trunk, and then you need to choose whether you go to the right lymphatic duct and or thoracic duct, and eventually you will drain into the left or right angle. If you are not sure about this information, please make sure to watch the general overview of the lymphatic system to understand how does the lymphatic system work. Now, where do these groups of lymph nodes drain? Anteriorly, you are draining into the parasternal lymph nodes, all right? So the parasternal lymph nodes will take you to the bronchomediastinal trunk. If you are on the right side, you will get into the right lymphatic duct. If you are on the left side, you will drain into the thoracic duct. However, posteriorly, the posterior intercostal nodes, they drain into the thoracic duct only, and from that, you go all the way and drain into the left angle. Okay, so the thoracic duct takes you to the left bronchomediastinal trunk, and that takes you to the left angle. And this is when we talk about the posterior thoracic wall and the posterior mediastinal nodes. Okay, so anteriorly you have parasternal, you are following. If you are on the right side or left side, you know where to go. But if you are posterior intercostals and posterior mediastinal, it means you need to drain into only the thoracic duct. All right, with that, we're done with the thoracic wall anatomy. Thank you guys for watching. Don't forget to like and subscribe, and see you in the next concept.